Hi, I'm Dr. Nancy Inshiply, and today we're going to talk about something that's been making waves in the world of orthopedics, platelet rich plasma, or PRP for short. You might have heard about it before, but what exactly is it, and how can it help you with injuries or joint pain? Let me break it down for you in simple terms. PRP is made from your own blood, and it is packed with something called platelets. Now, platelets are the parts in your serum, in your blood, that help you stop bleeding when you get a cut. But here's the interesting part. They also contain special growth factors that can help your body heal tissue, and that includes muscles, tendons, and joints. Normally, you have about 200,000 platelets in every drop of blood, but in PRP, we boost that number into the millions or even a billion. That's several times the usual amount, which gives your body's natural healing processes a kickstart. Making PRP is quick and easy. First, we draw some blood, just like during a regular lab test. And then we spin it in a machine called a centrifuge, which separates out the platelets and growth factors we want to use. The whole process really only takes a few minutes, and it's all done right here in the office. So, what can PRP actually be used for? There is a lot of research out there, and PRP is showing great and promising results for several orthopedic conditions. In fact, over 30 studies have found that PRP works better than steroid injections or hyaluronic gel injections for things like osteoarthritis of the knees. But that's not all. PRP can also help with tendonitis, partial tendon tears, ligament injuries, bursitis, and even some types of fractures. After we make the PRP, we inject it directly into the injured area, whether it's your knee, your shoulder, or your elbow. And I often use ultrasound to do it. You may feel some soreness after the injection, but that usually fades fairly quickly. One important thing to know though, if you're taking anti-inflammatory medications like ibuprofen or aspirin, you'll need to stop them for at least 2 weeks before and at least 2 weeks after the injection, because they can block the effects of PRP. Tylenol, however, is fine, and the one anti-inflammatory exception is Celebrex, which is generally allowed. After the injection, we'll ask you to avoid heavy activity or sports for about a week, but don't worry, you'll likely be able to go about your normal routine as long as it's not causing pain. Some people start feeling better in just 4 to 6 weeks, while others notice some improvement even sooner. And the effects can last for a year or maybe even more, making PRP a great option for long-term relief without surgery. Now, let's talk about risks. Like any injection, there's a small chance of swelling, discomfort, or infection, although that is very rare. But because PRP is made from your own blood, there's no risk of allergic reaction. One thing to keep in mind is that no two PRP treatments are exactly the same, since everyone's blood is unique. And so that can sometimes make it hard to predict exactly how well it will work for each person, but research is ongoing and the results are very promising. PRP isn't the right fit for everyone though. If you have a clotting disorder, autoimmune disease, or you're on blood thinners, you'll need to talk to us about those conditions first. Also, PRP might not be recommended if you have anemia, cancer, an active infection, or some other blood condition. Now, what about insurance? Here's the downside. Most insurance companies in the US still don't cover PRP, and that means that is a cash pay procedure. The costs vary depending on how many injections you need and which areas we're treating. But the good news is we do offer flexible payment options, including credit options, to help make it more affordable. Your HSA or FSA can also be used. And so if you're thinking about PRP, we're here to guide you through the process. You can schedule a consultation with us and we'll answer all of your questions to see if PRP is right for you. Thanks for tuning in. I'm Dr. Nancy Inshiply, and this is Form and Function Orthopedics.